Good evening. Welcome to the Amalgamated Clothing and Textile Workers Union office in Biddeford. My name is Mike Cavanaugh. I'm a representative of our union here in the state of Maine. This evening we're going to be talking about healthcare, the American healthcare crisis, its impact on citizens here in the state of Maine, and proposals at the national level for healthcare reform. I'm joined this evening by a man who's well known throughout the state as being perhaps one of the state's leading experts on the healthcare crisis and solutions, Neil Rolde. Neil is a former Maine legislator of some 16 years in the state legislature, I believe, an author of a number of books, including So You Think You Know Maine, and most recently, or not most recently, but 2 years ago, was the Democratic candidate for the United States Senate for the state of Maine. And significantly, Neil's campaign was largely, not solely, but largely focused on the issue of health care, and in particular his advocacy for a single-payer Canadian-style solution to the health care crisis. Neil raised the issue throughout the state of Maine in a very widely publicized campaign about the health care crisis in the state. And since that ultimately unsuccessful campaign for the Senate, Neil has been about the business of writing a book called Your Money or Your Health. And here's a copy of the book. And in fact, here's the author. Welcome, Neil Rolde.
Thank you very much, Mike.
Glad you could join us.
Hey.
Neil, we'd like to talk a bit about your book and about the healthcare crisis in general. But let me start by just making my own personal observation, and we haven't discussed this before. I don't know what you think about it, but you ran a campaign for the Senate in 1990. I think you would agree, focused largely on the universal health care single-payer issue. Senator Cohen was successful, although you garnered some 40+% of the vote, as I recall. 1 year later, in Pennsylvania, Harris Wofford ran for the Senate on essentially the same type of campaign and won, and is now a sitting United States Senator. And it has been my own personal belief that you're raising that issue here in the state of Maine the way you did led directly to the decision made by the Wofford campaign people, including James Carville and others, to focus on that issue. And in fact, that issue is now front and center before the United States Congress in the presence of President Clinton. And I wonder, looking back on it, what you think in terms of where you took that issue and how that issue took off after your campaign.
Well, like a good politician, I'll always take credit for anything. But yeah, a lot of people have sort of said jokingly, you know, you were just ahead of your time, and I probably was. And we did, in fact, there was a direct connection between our campaign and the Wofford campaign, because the fellow who did my commercials was a very good friend of Wofford's son, and so they did use some of our material as a model for their campaign. The point was that the issue was there. When I started my campaign for Senate, you take a poll, you know, they call it a benchmark poll. You're supposed to find out what people are interested in and what the issues are. Healthcare didn't even show up on that poll. I mean, I was told that the thing I had to stress completely was drugs, that's what people were concerned about. Well, in all the time that I campaigned, almost 2 years, I think I probably had 2 or 3 people who talked to me about drugs. And literally thousands of people who talked to me about healthcare. And the reason that I raised healthcare was, one, I had served on the health committee in the Maine Legislature. 2, I knew what a mess the situation was, and it was getting worse all the time. And it was something that I felt very strongly about. And also a group of doctors, actually, were the ones who had turned me on to the Canadian healthcare system, which I hadn't paid much attention to before, and had sort of, like a lot of Americans, said, oh, well, it's sort of second rate, it's not something that we want. And after reading an article by two doctors that was in the Portland paper, I went down and talked to them. They were down in Cambridge at the Harvard Medical School. And they convinced me that I should go and take a good look, and I did. And I was very impressed by what I saw. And that's when I began to raise it as what I saw as a potential solution to the crazy quilt problems that we were having in this country. Because it was like like one of those light bulbs going off, and that there was something that had been done, and they've had it now for 20 years, and they have some problems with it, but certainly it's the most popular program up there, and it seems to work very well.
Okay, well, it seemed to me that you mentioned light bulbs going off, and it was my sense during the campaign, and I know from talking to union workers in various mills and factories around the state that I deal with, during the course of your campaign, there were a lot of light bulbs going off. The issue of health care just connected with so many working people who struggle to make ends meet and who are wiped out. We see this continually, and Biddeford is no different than Waterville or Lewiston or many other communities in the state of Maine, in that healthcare crisis can drive people right under.
I think the thing about healthcare is, a lot of the issues that come out in politics are to most people something that you read about in a newspaper, like drugs, for example. Most people, unless you maybe one of your kids or something got into drugs, you don't really have a direct connection with it. But healthcare, everybody's got a direct connection with it. And it doesn't matter whether you're a union worker or even a millionaire. If that person's, somebody in their family gets sick, they know what it's like. Everybody's been to the hospital and gotten these horrendous bills, which I hear about all the time.
I'm sure, yeah. Well, the issue is certainly out there, and I don't want to, spend too much time talking about history, but I think it's significant that here we did have, through Neil's campaign, an early opportunity to really raise the issue of a universal health care system in the state of Maine. And there's been, in the last 2 or 3 years, there's been activity at the State House, not just in Maine, but throughout the country, in terms of trying to deal with statewide solutions to the problem. But let me just turn for a minute to the book, which is on sale, I'm sure, at your local bookstore. I guess I'd like to start by asking you how the idea for doing the book came together, because without reading the entire book to our audience tonight, I would say that this may be one of the more comprehensive, not just focuses on solutions, but in terms of the history of the development of the healthcare system and the healthcare crisis in the United States. It's a very readable history. This is not the sort of history that people might remember from a history class in school. This is a very readable and lively, I think, history of how we came to be in the situation we're in now. I wonder if you could talk for a minute about how you got to here.
Basically, while I was campaigning, I was finding out there was a tremendous amount of information and misinformation flying around about the healthcare crisis. And I was finding, as I went along, I was learning a lot more about it. But there was one of the things I found, there was no real one book where you could go and really get all of this information. Most of the books that I came upon were either outdated, there were some that were written back in the 1970s, or they were very technical, or they covered one aspect. Somebody wrote about hospitals, or somebody wrote about the AMA, but nobody had pulled it all together. And so that's why I finally decided to do this book. And in the course of it, I learned an awful lot myself, things that I wish I knew when I was running, some of the information. And particularly, you talked about the history. When I was running, people would say to me, oh, well, wasn't that something that Ted Kennedy talked about back in the 70s? And then somebody else would say, well, yeah, didn't Harry Truman want to do something? Well, I found out, it went all the way back to the turn of the century. It went back to Teddy Roosevelt, and even before Teddy Roosevelt. And we've been kicking around this thing for almost 100 years in this country. And then the other part that was interesting, of course, was to try and find out what other countries did. And I had spent some time in Canada, and done a little bit of study of what some of the other countries like Germany and England and Japan, and then people would throw up and say, why don't you look at the Australian system? So I did some study on that. And then later on, I even went down and looked at the Cuban healthcare system. And since the book is out, I've been out now to look at China. And but so it gave me an opportunity to spend some more time looking at those other countries, because everybody knows that we're the only major country really that doesn't have a national health care system. And some people were saying, well, Republic of South Africa is another one. I said, that's great.
Yeah, great company to be in.
And then I found out they've got a national health care system for their white population.
Yeah.
So, and actually, the interesting thing is that on my trip to China, I found the one country that's more like us happens to be Red China, Communist China. They do not provide health care for all their people, strange enough.
That's interesting. You mentioned, going back and people saying during the campaign, didn't Ted Kennedy want to do something about this? I can just recall personally when I first started working for our union in Chicago in 1973-74, one of the major projects that I was involved in working on for a period of time was on what was called the Kennedy-Corman Health Reform Bill or whatever. And of course, I was young, just out of college. I didn't, I sort of figured, well, this was, we're going to take care of this, and then we're going to move on to the next item. And sort of got stuck in a time warp there, and have been on essentially the same issue for now 20 years. I would say certainly, though, that, and I imagine anybody would agree, that this issue, although it's been a problem and it's been a festering and growing problem for all these years, only really within the last couple of years, and right now has it taken really center stage in the national political scene?
Yeah, well, if you go back and look at it historically, what I say there are we're in the fifth wave, actually. Been 4 waves of attempts to have a national health care program. The first was from around the time of Teddy Roosevelt up through the World War I, and then Franklin Roosevelt, 35, when he almost was planning to make it part of Social Security, and then backed off when the AMA attacked him. And then you had the period in the the middle 60s when we ended up with Medicare and Medicaid. And this was after Jack Kennedy was assassinated and Lyndon Johnson came in. And then you had the period in the 70s, the early to middle 70s with Ted Kennedy, and that went all the way up until his big fight with Jimmy Carter, and that was the end of that. So we're in the 5th wave right now, and this is by far the strongest. I mean, there's just no doubt about it. You've got bills in almost every legislature. You have single-payer type bills, which are the most I don't want to say radical, but they're the
most comprehensive.
Yeah, the most comprehensive and the most controversial in a sense. And you've got those in about 25 different states right now, and more coming all the time. So there's never been an effort like this, and it's it's been curious. In between, there have been the groups that have wanted to bury this issue, and they've always liked to say, well, this is dead. Nobody's going to talk about this anymore. I can remember reading some stuff that came out in the 70s, from one of these so-called right-wing think tanks. Nobody's going to be paying attention to this issue.
Now they've got their own reform proposal.
Right, now they're coming in and saying,
yeah, you can tell it's serious when the Health Insurance Association of America, HIAA, which is the largest lobbying group for the private health insurance industry, they have a health reform proposal.
The AMA
is the American Hospital Association. I mean, everybody, bar none, is for health care reform.
Oh, absolutely. There's nobody now that says the system isn't broke.
Yeah, which seems to me to be the point at which we start to, it's starting to get very serious. People are expecting that there is going to be some kind of healthcare reform, but I think this is the point at which we've got to be very careful about what do we mean by reform. Since now everyone is for, quote, reform, it may well be that some of those reforms aren't exactly the type of reform that we, and when I say we, I'm talking about a large, what I believe to be a large collective we, primarily of consumers of healthcare as opposed to providers or those who in some way make their living off the system in terms of the insurance industry.
Yeah, and I think, when you examine many of these proposals, they're geared to the status quo, to people keeping what they want to keep, like insurance, the health insurance guys. I mean, basically, what they're saying is, well, let us keep what we have, and then you, the taxpayers, pick everybody else up.
Mm-hmm.
You know, we're willing to agree to that now.
Yeah.
You know, well, that's nice of them. But, and so you got, and the doctors, whatever their proposal is certainly not going to include cost control.
Mm-hmm.
And so this is the kind of thing.
Yeah. Well, I think we want to talk a bit about some of the different solutions, but I think it may be appropriate. I realize cable television. We're not going to be cutting away to a commercial break right now, but let me just say, for any of you who've tuned in the last few minutes and might wonder who we are and what we're doing here, I'm Michael Cavanaugh from the Amalgamated Clothing and Textile Workers Union. I'm with Neil Rolde. Neil's, among other things, the author of Your Money or Your Health, which is a very comprehensive history and analysis of the American healthcare crisis, and points to some solutions. We're here tonight in Biddeford talking about the impact of the healthcare crisis on residents in the Biddeford area, I assume, as well as what type of potential solutions, both at the state and national level, we might be expecting. Neil, let's spend a few minutes talking about where you sort of end up through the book. Safe to say that your book has done a very comprehensive history of the development of the healthcare system, the crisis that probably everyone is familiar with in one way or another, and then you point to one way out of the mess. And I wonder if you might talk about that for a minute.
I make no bones about the fact that I like the single-payer system, which is what they've worked in Canada. And again, another reason I wrote the book was there's been so much misinformation. Some of the groups, particularly the HIAA, but others, have seized upon every little flaw in the Canadian system to try and bash it and say, you know, this is something we could never have in this country, to try and give you the impression, you know, that it was thousands of people just, you know, standing in lines waiting for health care in hospitals that were horrible and falling down and so forth and so on. So I said, you know, I want to take some time and go up there and really spend some in-depth time talking to people, seeing what the system is like, and making it understandable to Americans as to what it's like. And so I've got at least 3 chapters there. And I began by going up to a place in Maine, to Madawaska, Maine, which is right on the border. Right across the way is Edmundston, New Brunswick. And to see what the relationship of people who live on the border in Maine is with the Canadian healthcare system, which most of them use. Because there's a brand new hospital over there. It's one of the nicest hospitals I've ever been in my life. It had just opened, and so I wanted to get the reactions of the Maine people who use that system all the time. And some of them were they all liked it. Some of them weren't totally happy with the kinds of things that kind of service that they'd gotten there, but they all liked the idea, and they all liked the way that the system worked in Canada. I even talked to a doctor who lives in Madawaska but practices in Canada, and to get, you know, a small town doctor and his approach to the Canadian healthcare system and how it works, you know, and again, one of the things I really like about it is the simplicity of it. And maybe for the audience we should explain how it works.
That's a good idea, because a lot of times we do talk in language and not everybody knows.
And people think, well, it's a government system, so you got this huge, humongous bureaucracy. One of the things that I think most people don't understand is how bureaucratic our own system, which is supposed to be a free enterprise system, is. I mean, we've got more bureaucracy in this system. To give you one example, the number of people that it takes to run Blue Cross Blue Shield in Massachusetts, which is about 2,000 people, is the same number the Canadians use for the entire country of 25 million people.
No. Well, I suppose you see in any hospital you would go to in the United States, in the state of Maine, the number of people that are
doing
employed,
all
processing papers, billing accounts, and so on.
So very simply, how it works in Canada is they have a federal government like we do. So the federal government in Canada, working out of Ottawa, sets a standard for the entire country. And it says, in any healthcare plan in the country, this is what must be in it. And it sets some basic benefits. And for simplicity's sake, we'll just say hospitalization is one of them. All medical doctor visits are another one. So that your basic things of being in the hospital, having to go to the doctor, are covered. They're part of the plan. The plan also, if you live in one province, you have to be able to use it in another province, so it has portability. And then the provinces, and then they also supply the money, or not all of it, but they supplied, originally they supplied half. And then the provinces make up the other front line. And what happens is the provinces are the only ones, the provincial governments, who can buy health care services from the providers, from the doctors and from the hospitals. So they negotiate with the doctors, they do it through the medical association, and they negotiate through the hospital, with the hospitals, for what they call a global budget. And the way it works out is after negotiations, and negotiations are always tough and difficult, just like labor union negotiations.
The same principle, though. That
It's the same principle,
by the group
exactly,
of numbers together, you've got some more strength than you do as an individual.
And then what happens is with the doctors, it isn't the government telling the doctors how much they're going to get paid. The doctors get a total overall sum, and then they split it up among themselves, and then they agree. So, and that's another thing I like about the Canadian system is you choose your own doctor. You don't have any problem that way.
I think that's a lot of the misconception I hear from talking to people. They think, well, it's one large bureaucratic system, and I'm not going to have any choice. They're going to tell me what doctor I have to use.
Absolutely not.
The government's going to run the program.
No, you choose your own doctor, and what you, as a citizen, do is you receive a card. It looks just like a credit card, and in one province I know it has a sunrise on it or something. And when you go to the doctor, you present the card, and that's it. They take an impression of it, and you don't get tons of paperwork, and you don't get some insurance company saying, well, you didn't do this and you didn't do that, so we're not going to pay you.
I mean, you don't have to call the 800 number at least.
You don't have to call the 800 number 24 hours before. You just go to the doctor. Now, what the doctor does, this is what Dr. Harrigan up in Madawaska told me. He has a sheet of paper with 8 spaces on it, and he just puts down your name as a patient, got your card imprint on it, your card number, and then what the diagnosis was and what he did for you. And he gets paid in so many units for whatever that particular operation or procedure was. And then he sends those in to the provincial government, and as he says, every 2 weeks he gets a check. This is a guy who practiced under the old Canadian system, which was very much like ours, who said, he was always chasing patients for money, never knew when he was going to get paid, would always have real guilt problems because someone would come in and need a certain thing, and he'd say, I know they can't afford it. He said, I don't have to worry about that anymore. All I have to worry about is, what is the patient's condition and what's the best way to treat that patient. And so that's the way it works. The same thing with the hospitals. They get a global budget. They have to live within it. Now, that isn't always easy for them, and there are times where they actually have to shut down a few beds. They usually do it in the summertime during their slow season. But they are also able, unlike hospitals in Maine, which are very, very rigorously regulated by the Maine Healthcare Finance Commission, they can try and get money in other ways. For example, I went in a hospital in Ontario, Hamilton, Ontario, and downstairs they had a travel agency, they had a big flower shop, they had an ice cream parlor. They were renting that space out and getting additional money. Now in Maine, if the hospital did that, they'd have to pay it back to the insurance companies. So they have a lot of flexibility. It isn't the government coming in and micromanaging and telling them, you got to do this, that, and the other thing. They have a tremendous amount of flexibility.
I just add one thing that I've noticed as being a real difference between the Canadian system and what we're familiar with on this side of the border, from the point of view of workers and their places of employment. Our union we represent people in Canada. We have local unions in Montreal and really throughout the Canadian provinces. And when I pick up the union newspaper and read about what's going on around the union, both in the United States and Canada, one of the striking differences is that virtually every time there's an article about a contract negotiation that we did here in Maine, say, it really focuses on how the union did protecting its members' health benefits, or how much more we were able to get the employer to contribute, or how we held the line, if we were able to hold the line on workers having to pay money out of their pocket. And it really increasingly focuses on negotiations, I can tell you from personal experience, focus on health insurance. Continually, we're negotiating about how to get better health benefits, or more recently, how to protect the health
Even what
benefits
you
we
got,
currently
yeah.
have. But when we look at what's the contract settlements in Canada all about, they never mention health insurance. I mean, it just doesn't come up. It's not an issue that's related to employment in Canada, and so you don't have to negotiate about it unless you're, negotiating on some additional add-on benefit beyond those benefits that are provided. And I was thinking about it because it enables workers and their unions and the companies as well to focus on the things that they are there for. That is, to focus on how to make the company more productive, how to provide for a better standard of living for the workers. And at the same time, it also frees up, as you said, the medical providers, the doctors and so on, to focus on treatment and prevention rather than everybody having to focus on how are we going to pay for this or how are we going to get around paying for that, which seems to me to be an incredible waste of our time and money that we are required to take here.
Yeah, I think one of the statistics I have in the book is that 73% of the strikes in this country have been over health care benefits.
Yeah.
And of course, I know a lot of the workers feel, well, we gave up an increase in our wages and took health care benefits instead. And then when you cut those, you're really cutting our wages.
Oh, there's no question about it. We have been encouraged, frankly, by, over the years, in part, frankly, due to the tax benefits. I mean, this goes back to the Second World War when there was the wage and price controls, and workers were unable to gain any increases in wages, but were able to get increases by health care benefits, and that's really where the employment-based system of health care benefits, as I understand it, originated.
So probably read that in there.
Well, I did. I read it right. For those of you who don't, I read it right here. I don't leave home without this. Your money or your health. But in honesty, we've got a system that has grown up over many years here, where health benefits are tied to your place of employment, and workers have. Those who've been able to negotiate, who are represented in collective bargaining through their unions, have been able to negotiate for health benefits in lieu of wages. I mean, it's money. The employer was going to have to pay money, and the money we decided would go, a certain portion of it would go into providing health benefits, and frankly, an increasing portion of it has gone into providing health benefits. Now, there are proposals on the table that talk about changing the healthcare system altogether, and change is going to be difficult for everybody. I'm sure there are a lot of people in Biddeford, there are a lot of members in our union and other workers, I'm sure, in the area who recognize the need for a change because the current system is killing them. They can't afford it. It doesn't cover what it's supposed to. But there are going to be, seems to me, problems with change, any kind of change that rubs people the wrong way. I wonder if I might ask you to dive right in and comment about one of the changes that's being considered that relates very much to what we're talking about, and that is the taxation of health benefits. For those who may not be familiar, the system right now provides that if you get your health benefits through your employer, the employer buys those health benefits for whatever number of dollars it costs per month. You get the benefits, but you don't need to report those benefits, or the cost of those benefits, as part of your income. You don't have to show it on your 1040 form that's income. One of the proposals that has been kicked around quite high levels in Washington in the last few months, I understand, is a proposal that would tax those benefits as income, or at least a certain portion of those benefits as income, and would no longer give the employer the tax advantage of being able to buy those benefits essentially with non-tax dollars. It's a controversial topic, and I wonder if you might comment about it.
Well, I think to do it, part of the question is, what do you do it in connection with? If you do it just by itself, I think it's going to be a very detrimental thing, obviously, just a way to grab some more tax money. One of the things that they did in Canada, interestingly enough, was, and we hadn't gotten that far in describing how the system's paid for in Canada, and it's simply paid for through general taxation. But what they did when they switched over from our type of system to theirs was they didn't want to give the companies a huge windfall because they were paying for taxation. So they turned the amount that the companies were paying into a pay increase for the workers. And then it was reflected in their taxes eventually. So when they were paying for through general taxation for health care. But they all got that as a raise, and so and that apparently was a very smooth way to do it. I mean, the problem with just now taking away that tax benefit and starting to tax people on it is that if you do it in total isolation, it's just another tax increase, and you don't get anything for it. In fact, you're far worse off than you were before. I think one of the ways they've talked about doing it is in connection with this plan that people are now starting to hear a lot about, what they call managed competition. And I'm still, after all that I've read, I'm still not totally sure how something like this works. It's an idea that comes out of California. It was invented by an economist at Stanford University by the name of Alan Enthoven, and then picked up and sort of refined by the insurance commissioner in California. His name is John Garamendi. And what they're talking about is like a series of HMOs. And for those who may not know what an HMO, it's a health maintenance organization. It's where you pay a set amount to this group on a yearly basis. And then you go to them, and they're supposed to supply you with all of your health care needs. The biggest one, probably the most famous one, is the Kaiser out in California. It's a huge outfit, and so you pay X amount of dollars, and then you go and see it. Now, the idea of managed competition is that everybody in the U.S. would be in one form of HMO or another. And they would have like basic HMOs, which would give you the basic benefits. And then they would have some that were a little bit more elaborate. And originally, I guess they were talking about the taxation of benefits, that if you were in the basic one, you wouldn't be taxed for your benefits. But if you decided you wanted something a little bit better, then you'd have to pay some taxes for that. And the same thing with the employers. If they had the basic proposal for their workers, they would still get their tax credit. If not, if they were going to give them something better, they'd have to pay some more for that. Now that is the idea. Of course, some of the complaints about HMOs are that, one, you don't have a choice of doctor. Two, under the present system, HMOs are also, they're not only providers of health care, they're insurance companies. So they won't take everybody. I mean, if you've got a pre-existing condition, if you've got cancer, or you've got a heart problem, they don't want you. I mean, I've talked to people who are in Kaiser out in California, and they say it's good, it's very good, but I can't get my daughter in there because she's got a problem. Now, I think under any system that they put in, they would not allow that. They would have to take you. Now, that's another problem, because some of those companies, if they keep taking the people with the toughest problems, are going to go out of business, which many HMOs have done. And so it's not simple. And then the other complaint about it is that you need at least a base, I've been told, of 500,000 people. And so the governor of South Dakota the other day at the National Governors Conference said, this isn't going to work in our state. And we in Maine, we talked to Senator Mitchell about this. We're very concerned that it sure as heck isn't, because you wouldn't have more than one or two of these, they're going to call them sponsoring organizations.
Yeah, I understand they're going to be called health insurance provider co-ops, or HIPICs.
Oh, really?
The jargon that we're going to need to learn now is something called HIPIC. But I understand from what I read that this is very much a developing plan that everyone now is, the buzzword is managed competition. Right. And there are managed competition plans that President Clinton early on this year, or late last year, made some references to managed competition being a sort of idea that he might be supportive of. And as a result, it seems that as a result of that, every major healthcare reform proposal that is in the hopper right now somehow has managed competition weaved into the name of it, at least. And it seems that there is sort of the small market reform, the former Bush proposal of managed competition, the pay-or-play approach that Senator Mitchell favored earlier now has a managed competition pay-or-play. There's a conservative Democratic Forum, the Jackson Hole Initiative Group, and now what I understand is a single-payer managed competition approach that I don't know whether you have much familiarity with it, but...
Well, I understand that Paul Starr, who's a very good writer on health care, who's, I guess, advising Mrs. Clinton, has proposed that, and I really haven't had a chance to study what he's talking about, how you would work that into a single payer. But of course, if in Maine we had a single payer, it could be an HMO.
Right. Well, that's one of the reason I wanted to raise that is because you mentioned about the problems of small states like Maine, South Dakota, others, and that, as I understand, the managed competition approach that Paul Starr is talking about is that one could very well have a statewide single payer in a rural state like Maine that would fit into the overall plan of a national managed competition approach.
Well, one of the things that we talked to with Senator Mitchell was. He had a series of meetings with people around the state who were interested in health care, and was the possibility, and this was actually an amendment that he had allowed to his own bill, which would have allowed the states to do some of their own things, to have a single-payer system if you wanted. And because, I mean, we were very skeptical that managed competition would work in the state of Maine, so if the national government decreed that that was going to be the standard for the entire nation, we could be in some real problems. And he seemed to like the idea that maybe there should be a period of time when the states could do their own thing. But in order to do that, we have to get the help from the federal government. I mean, we can't do it without the money that they're putting in now into Medicare and Medicaid and the Defense Department and the veterans and so forth and so on. So whether they would go in that direction or not, I don't know.
Well, I would say that in the state of Maine, as people may be familiar, there have been some very serious efforts here to try to advance the notion of a single-payer system in the state of Maine. We've had, and Neil and I have both been involved with a fairly active coalition, Consumers for Affordable Health Care, here in the state of Maine that represents lots of different community organizations and senior citizens groups and labor unions and others really throughout the state who've been working towards some type of statewide solution to the health care crisis, because quite honestly, during the Bush years and before, we didn't have any hope that we were going to have much assistance from the federal level. So a lot of our efforts, quite frankly, were focused on the state level. Well, there's a new ball game in Washington, but there still is a very active effort going on at the State House in the midst of budget crisis and everything else that's going on in Augusta. There's still an effort, and in fact a bill in this session of the legislature that would provide essentially for a statewide universal health care system in Maine. And I don't know if it'd be fair to ask you to comment about that bill. I don't know how familiar you are with the particulars, but for our viewers, what might this look like if we were successful in achieving what we would like to achieve? What would it look like to the citizens of Biddeford?
Well, I haven't seen the final bill, and I understand that it's been changed a little bit, so it's not just totally a single-payer bill. So, and in fact, the final bill, I talked to one of the sponsors the other day, has not even been written at this particular point. I guess, and then I guess we got to throw some more realism into this too, because we have a chief executive in the state who I don't think this will get by in any way, shape, or form. In fact, he's trying to undo what we've already done, which is the Maine Health Program.
Right.
And for viewers who might not remember, the legislature at one time actually raised taxes, and for the purpose of trying to cut into the 150,000 people in the state of Maine who don't have health insurance.
Right, those were specific, as I recall, some specific taxes raised on, was it cigarettes?
Cigarettes, alcohol, and used boats.
Used boats. Don't smoke or drink those used boats, apparently.
And
used boats are dangerous to your health.
Well, I know, because I heard from my boat dealers about that when I voted for it, and they weren't very happy. And but anyway, we did it, and we took a lot of the grief for it, but we never actually dedicated that money to it. I tried later, after the governor tried to kill the program. I mean, and what really bothers me is that Governor Kernan is trying to kill the program but keep the taxes.
Yes.
And that really is what frosts me. And he's still trying to do the same thing.
Yeah, this is a battle. It's not new. Every year since this Maine Health Program was established 2 or 3 years ago, there have been efforts. I think this is now the 5th effort.
And there was a huge coalition of people, and it included many of the providers. It included the doctors in the hospitals, because one of the things in that program was also to help out the hospitals with a problem that they have. Because, you know, the fact is that people don't have health insurance, but they will still, if something, you know, happens very serious to them, they'll end up in the hospital in an emergency room, and they'll get some treatment. And then the hospital has no way to be paid for that. So what the hospital does, of course, is jacks its prices up. And that's one of the reasons that healthcare costs are going out of sight. So one of the things we did in that bill was to put some money in for hospitals to help them with their bad debts and their charity cases. And that's why we had broad support. We had the Chamber of Commerce. We had all kinds of people supporting us. So we've got a governor who's, I mean, he's trying to kill that, so he'd never go for any kind of national.
Well, I'm sorry, I neglected to mention that we do have, but
anyway,
in the perfect world,
if we were to get a really good program, I mean, what it would mean to the people of Biddeford is if we were able to set up a single-payer type system, whether it was the government, and some people are skeptical of government, but you can have, let's say, a Blue Cross Blue Shield, or you can have somebody else running it if they don't want the government to run it. You would have the simplicity of the system in Canada, and where you don't have to fight with the insurance companies for them to pay for you, because I mean that's what they're really trying to do to you now, is to get you to pay as much as you can out of your own pocket. You wouldn't have to worry about losing your home, and I've had a number of people tell me, because somebody got sick and they couldn't pay the bills, they were out. And I'll bet you would find among some of the homeless people that's one of the problems that happened. And so that's another thing. To me, what you would buy is simplicity, access to health care, and security. And that's security is probably the most important to me. That you wouldn't have to worry eventually that you're going to lose everything that you worked your whole life to get.
Well, the skeptics, though, are going to say, and certainly they have, well, this is another big government program. It's going to cost a lot of money. We are taxed to death now. All you're talking about is tax and spend and so on. And I wonder if you might, for our viewers, sort of explain how such a program, whether it's on the state level or at a federal level, how would that plan be financed, and how is that different from the way people are now paying for their health care?
Okay. Well, for me, the best system would be to finance it through your general taxation. People are going to say, well, taxes in Canada are much higher than they are here. But whatever is done is going to cost a lot of money. Managed competition is going to cost money. If they try to take away, make you pay taxes for your health benefits, that's going to cost money. The Bush plan for vouchers and so forth is going to cost billions of dollars. But you weren't going to get very much for it. At least here you're going to get something for your money. And it will come down to looking and see, how much will this cost you in taxes, and how much you pay now out of your own pocket for, I mean, many of the elderly, for example, are paying a tremendous amount of money out of their own pocket for Medigap insurance. I don't know how many workers are left whose employers pay 100% of their costs, but I suspect that's going down pretty fast.
It's rare, and I would also point out that in situations where we do have companies that are paying supposedly 100% of the cost of the employee's health care, in fact, that's money that is being redirected. If it wasn't being, that's money that might be in wages, but instead of being paid in wages, the employer is paying it to the health insurance company. But most of them, of course, even if they are paying a portion of the premium, the worker is still paying money out of their pocket because they may have to make some sort of monthly premium. The employer may pay for the employee, and if you want to cover your family, maybe you've got to pay that difference. That's fairly common. Certainly, whatever plan you have, most of them have got a deductible. You've got to pay the first 100, 200, 500, whatever dollars it is before your health insurance kicks in. And then your health insurance will kick in and pay up to what the so-called usual, customary, and reasonable fee is in an area, and there aren't too many places that charge usual, customary, and reasonable fees, in my experience. And so workers are left with money that they're paying out of pocket then.
And then if you have an 80-20 policy, you know, you're going to end up paying 20%.
20%.
And, you know, I can remember meeting a gal who worked up in Winthrop in that factory up there at
The Hathaway plant, or Carlton Mills,
Carlton
yeah.
Mills. And she had just had an operation, and here was just, you know, a gal working in a shop, and she came out of that, despite having company insurance owing $17,000.
Yeah.
That's an awful lot of money
Yeah.
for someone who's just who's just got a job working in a factory.
Right,
and,
right.
She would probably spend the rest of her life trying to pay that off.
Sure, sure. And then also probably not be insurable under the current system.
Right.
Once a person has got a medical problem, if they're not staying right within the health group they were in through their employer, their ability to get health insurance anyplace else is, you know, virtually impossible.
Well, your ability anyway under our system. I mean, for example, I'm not in a group. I'm self-employed.
Mm-hmm.
And I'm having a heck of a time trying to find anything but an 80-20 policy.
Mm-hmm.
And I'm paying through the nose for
Sure.
it, believe me.
Sure. Well, it's certainly, I mean, the problems, there are so many horror stories that are out there of situations of workers that you'd know, or you know, whoever it might be, that have had a real health crisis. I think what's different now is we have an administration in Washington that has made reform of the healthcare system a very top priority, and I know tonight, I realize this is being taped and is probably shown sometime after the President's State of the Union address, but as we sit here this evening, we're waiting. President Clinton will be giving a State of the Union address a little later this evening, and certainly will make guaranteed reference to the healthcare costs and the fact that healthcare costs are driving the federal deficit to a large extent. And the President has appointed a task force headed by Hillary Rodham Clinton to analyze and put on his desk a plan to deal with the healthcare crisis in this country. That's so different than what we've had over the last 4 or 12 years that it's startling. It's hard for me to know how to relate to the fact that, hey, we're going to have a real plan here. It may not be everything I like, and I'm sure there's going to be things about it that I would like to see improved, but I have no doubt that a plan is going to be put forward.
Well, you know, it's the difference between leadership and non-leadership. I mean, you're going to have a guy who's saying, you know, we're going to do this. He's sticking his neck up, and you're going to have as many people jumping on him as you got jumping on him right now, and it's economic.
Yeah, I suspect there'll be more even. It'll be they'll be jumping with
right, but
both feet.
yeah, and because I know some of probably the single-payer people will be disappointed in whatever he comes out with, and but at least we're going to go forward on a national level, and at least the problem has been really recognized, and there's an attempt to deal with it on a governmental level. Yeah. So whether they will allow leeway for some of the states to experiment, I don't know. But we also have to be ready here in Maine to push hard. Well, we can get by the next 2 years to get something done here.
Well, I think that's true. I would suggest, just sort of editorially here, if I might, I suppose we can. We're here in Biddeford and in Maine, and I think that as the healthcare solutions to the healthcare crisis are developed, and there's not going to be a quick fix. It's not like this problem's going to be solved at the state or federal level next month and we can go on to something else. I think we would agree that this is going to be the solution to this is going to be a continuing and developing program over some time. I think citizens in the Biddeford area in particular have the opportunity to have a lot of influence on that. One is that our United States Senator, Senator Mitchell, is the majority leader. That's a position of great power and influence in Washington, and Senator Mitchell is somebody I think we would both agree is a very accessible guy given his position. He's certainly in great demand, but he certainly wants to hear from the citizens in the state of Maine, and I think people here in Biddeford can and ought to let Senator Mitchell and his office know what you want, how you want to have the healthcare solution fixed in this country. The other thing is that we were fortunate to have the president of the Maine Senate from Biddeford, Senator Dennis Dutrumble, dealing with this crisis and developing a solution on the state level. Senator Dutrumble is going to have ultimately a very important role to play, and I would think that Particularly here in Biddeford, people have some opportunity, and I would argue maybe some responsibility, to try to let their elected representatives know how they feel and what they think the solution should look like. Let me, again, just for those of you who may have tuned in late, shame on you for tuning in late, but we'll accept you. Stay tuned. Don't turn that dial. You're watching channel whatever you're watching. I'm sorry.
12.
Channel 12. How could I forget? Channel 12. And I'm Mike Cavanaugh from the Amalgamated Clothing and Textile Workers Union. I'm here with Neil Rolde. We're discussing Neil's book, Your Money or Your Health, America's Cruel, Bureaucratic, and Horrendously Expensive Healthcare System, How It Got That Way, and What to Do About It. A rather topical book right now, as the entire federal government is grappling with the problem of what to do about the healthcare crisis. We also have been talking about some of the current discussion about where to take the healthcare solutions in the country. And I just wanted to ask you, Neil, for a second, if you would comment on the Wall Street Journal, which is a very influential newspaper in the country, and one that I often don't share their editorial point of view, but the Wall Street Journal is paying a lot of attention right now to the development of a healthcare reform proposal. And yesterday's paper was full of letters to the editor, voices in the healthcare debate. I brought this in. I suppose you can't really see it, but take my word for it. The paper was full of commentary yesterday that reflects some of the Wall Street Journal's thinking and some of their readers' thinking about this. And I guess I'd like to suggest, Neil, if you might comment on a couple of the letters that were written here. One is that says, we cannot talk seriously about healthcare reform without a commitment to identifying the extraordinarily high costs of treating preventable diseases. Cigarette smoking causes nearly 500,000 of the estimated 1 million premature deaths annually. All of us absorb more than $35 billion in costs associated with treating smokers who at a relatively young age develop cancers, pulmonary disease, and heart ailments. Smokers should be assessed a user's fee, not a general tax that could be hijacked for other purposes, to compensate for the system. The system, private or public, and for the inevitable costs of treating smoking-related diseases. That's one point of view on a way that we ought to fund the healthcare reform package. I wonder if you'd comment on that.
Well, in effect, that's what they have done in Canada. The Canadians had a much higher rate of smoking than the United States. Mm-hmm. And as not necessarily just to fund their program, but as a deliberate public health measure, they put horrendous taxes, and they really are. I mean, I hate to tell the smokers how much it costs for a pack of cigarettes up there.
Oh, they'll tell you. They know. Smokers know.
And they did the same thing with alcohol, too. Mm-hmm. And so, but that was a deliberate public health measure because one of the things that I've heard, and I've been doing, in conjunction with the book, I've been doing a lot of radio talk shows from all over the country, and people calling in. I do them by telephone. And, and I had one young guy say, well, I'm young, healthy, I don't smoke, drink. I don't want to have to pay for people who, are in that condition, don't take care of themselves. And that's a valid objection to the national health care program. So I think that what they did was, in a sense, the user fee that this woman is talking about. And it's had real effects up there. Although they've only brought it down to about where we are. Presumably, when they choke off the cigarettes that are smuggled from the U.S., they'll be able to do even better.
It seems reasonable that that's an aspect, but I think it might be, we might sort of be taking our eye off the whole picture to the extent people want to focus on smokers as the problem.
Well, I guess what you got is a much broader issue, and that's a whole issue of preventive health. And everybody talks about it, but I don't see that a lot of people do a great deal about it. And there's going to have to be a lot of different changes in the way we think about health care if we switch over to a national health care system. For example, one that's not mentioned at all really is medical education. And it just so happens, since we're here in Biddeford, I'm on the board of the University of New England, which has the only medical school here in the state of Maine. And our mission at UNE is to turn out primary care physicians, the old family docs. And we have a tremendous shortage of them. In fact, the United States is just the opposite of really the rest of the world. In most of the other countries of the world, about 70% of their doctors are primary care physicians, about 30% are the specialists who really cost the money. In the United States, it's just the opposite. It's 70% specialists, 30% primary care.
You think that might have anything to do with the amount of money that you make as a specialist as compared to a primary care physician?
Well, of course.
Just a question.
Well, the connection really goes back to the poor student who comes out of medical school owing at least $100,000, maybe even more, and is under tremendous pressure to pay that debt off. And then with the problems that doctors have in this country now, the huge overheads, all the paperwork that they have to do, the people they have to hire, the malpractice costs, which is a whole other issue. There's terrific pressure on doctors, even when they're the most idealistic in the world and want to treat people in a primary care situation, to get out of it. I just had a very good friend who's one of the best doctors, one of the most idealistic doctors that I know, who's working up in Dover Foxcroft, Maine. He just went bankrupt. He just could not keep up with it, and so he had to leave the state. He had to go to work as a salaried physician for a hospital in Pennsylvania, and you know, that's a tragedy for the people. I mean, this guy delivered all the babies up there, you know, and he was the only one who would take Medicaid patients and that kind of thing. So that has to be changed as well.
There is a group of doctors here in the state of Maine, part of the National Coalition, the Physicians for National Health Program, where, and I've heard a number of the physicians here, Cliff Rosen and others, talking about the number of people, the amount of money that's added on to the cost of health care just by the additional people they need to hire because of so-called managed care. I mean, everyone now, virtually everyone, is in some type of managed care program where an insurance company is looking over your shoulder to be certain that you certify your admission to the hospital. They then are reviewing everything the doctor does, everything the radiologist does, or whatever treatment you're going to receive has to be approved by the insurance company or by their staff. And you know, some of that may be warranted because there certainly have been instances of unwarranted extra treatment, extra care because they can run the meter on you. But the amount of cost that's added to the system by people watching each other seems to me to be a colossal waste of our resources, and the patient doesn't get any better. They don't get.
I mean, there's all kinds of problems with that. I quoted a Canadian doctor who was probably one of the leading specialists in internal medicine in Canada, founder of a major hospital, teaching hospital, and he was saying why Canadian doctors are no longer going to the United States and why they're coming back. And he talked about one of his cohorts in the United States, a similar type doctor, who has to get permission for a patient, you know, and this guy's been practicing for 40 years. And who does he have to call? He talks to a student nurse who's, you know, I mean, that's the kind of thing that's driving doctors absolutely insane. And, you know, the thing is, and one of the points that should be made, you know, if the United States weren't the only country that was in this situation, I mean, if everybody else was like this, we probably wouldn't be here talking about it. But, you know, every other country's found a way to have a national health care, and they've done it cheaper than we do. I mean, anywhere from 30 to 50% cheaper in terms of their gross national product and what they're paying for health care. And what's happening in this country, I use the figure, we were paying 12.3% of our GNP for health care. And this is in a year, it's up to 14% already. And it's heading very rapidly.
The projections certainly are all that this system is spinning out of control. The costs of it are you know, increasing at rates that will literally bankrupt companies. I mean, companies already are bankrupt, and individuals as well. I'm afraid that we're nearly running out of time. I would like to just thank you, Neil, for coming in and sharing with those of us in Biddeford your thoughts about the development of healthcare reform. I think your book certainly makes a great contribution, as did your campaign, and I think a lot of us owe you a great debt of gratitude for raising the issue in the way that you did.
Yeah, thank you for letting me get on my favorite soapbox.
Hey, you bet. Thank you again. This has been Neil Rolde and Mike Cavanaugh here in Biddeford at the Amalgamated Clothing and Textile Workers Union office discussing health care reform. And we certainly would like to once again urge citizens in Biddeford and in other communities in the state of Maine to let your voices be heard. This is an issue whose time has come. The time for reform is now, and your voice is important in making that happen. So you can pick up a copy of Neil Rolde's book at your local bookstore, and I really would encourage you to do so. I think there's a lot to be learned and help point us in the direction for a solution. Neil, thanks very much.
Thank you.
Okay. How do we know that we're done? Does the music come on? Huh?